The Health Council of Canada report on creating cultural safety for Aboriginal people in urban healthcare noted that
it is well documented that many underlying factors negatively affect the health of Aboriginal people in Canada, including poverty and the intergenerational effects of colonization and residential schools. But one barrier to good health lies squarely in the lap of the healthcare system itself. Many Aboriginal people don't trust and therefore don't use mainstream healthcare services because they don't feel safe from stereotyping and racism, and because the Western approach to healthcare can feel alienating and intimidating. Health Council of Canada, 2012.
Why is this? In order to understand this relationship, we must take a look at the way historical events have influenced Indigenous Canadians' perception of the health system. 29 segregated Indian hospitals were operated across Canada from 1945 to the mid-1980s. 7 of these hospitals were located in Alberta, more than any other province in Canada. Indian hospitals are not nearly as well known as residential schools. In fact, there is an almost complete lack of knowledge by most Canadians that such institutions ever existed. However, these segregated hospitals were incredibly damaging to Canada's Indigenous peoples. The government justified Indian hospitals by claiming that segregation was in the best interest of public health. There was a prevailing notion that
neither law nor treaty imposed an obligation on the Dominion government to establish a health service for the Indians and Eskimos. However, for humanitarian reasons and as a necessary protection to the rest of the population of Canada, it is essential to do everything possible to stamp out disease at its source, whatever it may be within the confines of the country. Brooke Claxon, Minister of National Health and Welfare, 1946.
Back when Indian hospitals were created, it was thought that Indigenous people were infectious and a public health threat to the rest of Canada because of tuberculosis outbreaks. These hospitals weren't specifically for tuberculosis patients. They also treated patients with all sorts of medical needs, including maternal health, injury, and various other diseases. Government staff were hailed as humanitarians and heroes, acting to protect the rest of Canada from perceived Indigenous contagion. Admission at Indian hospitals was not optional. People were taken from remote communities and transported to these facilities without their consent, without being given the opportunity to say goodbye to their family members, and without any knowledge of if or when they might be returning. Once admitted, patients were not permitted to leave. Many horrific things happened to patients of Indian hospitals, including physical and sexual abuse, forced sterilization, and nutritional experiments where patients were denied adequate food and basic dental hygiene. Invasive surgery was performed without the use of general anesthesia, using only local anesthetic while patients were still awake. Traumatic procedures, including removal of ribs and cutting out portions of lungs, were performed. Hospitals were understaffed, overcrowded, unsanitary, and poorly maintained. Contagious patients were not isolated from other patients, and as a result, disease spread quickly. Staff at the hospitals could not speak the same language as their patients, and people were not given any information about how long they would need to stay there. Many people didn't even know their loved ones were in the hospital. As a result, people were buried in unmarked graves on or around hospital grounds, without proper ceremony or protocol and without notification of family members. What sort of impact did the Indian hospital system have on people? And why are hospitals and health centers intimidating for many Indigenous people today? Indian hospitals, combined with other colonial influences, including residential schools and the 60 Scoop, contributed to feelings of disdain and mistrust of all government institutions, specifically healthcare institutions. The intergenerational trauma lives on today and is a major contributing factor in the way that healthcare is perceived by Indigenous people. Intergenerational trauma is the transmission of historical oppression and its negative consequences across generations. There is evidence of the impact of intergenerational trauma on the health and well-being of Indigenous people, and on the social disparities faced by Aboriginal peoples in Canada and other countries. Understanding this history, what can Alberta Health Services do? Alberta Health Services is seeking to repair this relationship and move towards reconciliation. As a provider of health care for all Albertans, Alberta Health Services has committed to follow the Truth and Reconciliation Commission's calls to action and address health-specific concerns in a culturally appropriate way. These calls to action are: Number 18, acknowledgement. Recognize and implement healthcare rights. Number 19, establish measurable goals and surveillance of health indicators, close gaps in health outcomes. Number 20, address distinct health needs of Métis, Inuit, and off-reserve First Nation people. Number 21, provide sustainable funding for existing and new healing centers. Number 22, incorporate traditional healing practices administered by Indigenous healers and elders. Number 23, increase Indigenous representation in the healthcare field. Ensure retention, provide cultural competency training. Number 24, medical and nursing schools in Canada are to offer mandatory courses dealing with Indigenous health issues. The Indigenous Health Program is an integral link to improving health outcomes for Indigenous peoples and to reduce health disparities between Indigenous and non-Indigenous patients. Some of the ways the Indigenous Health Program is making a difference include Elbow River Healing Lodge in Calgary at the Sheldon Schumer Health Centre, Indigenous Wellness Clinic in Edmonton at the Royal Alec Hospital, cultural helpers and traditional wellness counselors available throughout the province, Indigenous hospital liaisons on site at many hospitals, cultural competency training available for all Alberta Health Services staff. As our vision states, we focus on achieving healthy Albertans, healthy communities together. As an organization, we must focus on addressing racism and acknowledging biases against Indigenous people. We must work together on a common agenda across services and sectors within the organization and beyond to achieve a collective impact on improving physical, mental, emotional, and spiritual well-being and strengthen social outcomes for Indigenous peoples in Alberta. Together, we will work to acknowledge the traumas of the past for Indigenous peoples in order to create a common space for reconciliation and healing.